Hello, gentlemen. Let me ask you a very honest question. If you're over 50, 60, or even older, have you ever noticed something surprising during intimacy? You feel the pleasure, you reach climax, but there is little or no fluid released. Maybe it happened once, and your heart skipped a beat. Or maybe it has happened several times, quietly, leaving you worried but unsure who to ask. If that sounds familiar, this message is for you. First, let me say something important. This does not mean your masculinity is gone. It does not mean your intimate life is over. And it certainly does not mean something is seriously wrong. Most of the time, this is simply your body sending a message. Not a failure, but a signal that needs understanding. And once you understand what's happening, fear turns into clarity. And clarity restores confidence. So stay with me. The next few minutes we're going to explore why this happens, what it may mean for your health, and what simple medical solutions can help restore your peace of mind. Before we continue, if you find this topic helpful, give the video a like and subscribe. These honest health conversations help men everywhere. Now let's understand what's really going on. How ejaculation normally works. Think of your reproductive system like a perfectly timed machine. Your testicles make sperm. Your seminal vesicles add nourishing fluid. Your prostate adds protective fluid. All of this mixes together in a small channel. Then, during climax, special muscles contract in rhythm and push this fluid forward and out. It happens fast, and it depends on perfect timing between nerves, glands, and muscles. Here's something most men don't realize. Climax and ejaculation are not the same thing. Climax is the pleasure sensation controlled by the brain and nerves. Ejaculation is the physical release of fluid. Most of the time, they happen together, but they are actually controlled by different systems. This is why a man can feel full pleasure, little or no fluid. This is called dry ejaculation. It may feel strange, but it does not mean you have lost desire, pleasure, or masculinity. It simply means the delivery system has changed. Now let's understand why. The three most common causes of dry ejaculation. Retrograde ejaculation, when fluid flows backward. This is the most common cause. There is a small muscular valve at the opening of your bladder. During climax, this valve should close tightly, forcing the fluid to move forward and out. If this valve becomes relaxed, the fluid flows backward into the bladder instead. So you still feel pleasure, but little or no fluid comes out. Later, you may notice cloudy urine because the fluid mixes with urine. This often happens after prostate surgery, bladder surgery, certain blood pressure medicines, some prostate medicines. It is mechanical, not dangerous, and very common. Blocked ducts, when the pathway is narrowed. Sometimes the glands produce fluid normally, but the tiny tubes that carry it become partially blocked. This can happen due to old prostate infections, chronic inflammation, scar tissue, rarely tiny stone formation. When this happens, the amount of fluid slowly reduces over time. Some men may feel mild pelvic discomfort or pressure during climax. The good news? Many blockages are treatable with medications or simple procedures. Low testosterone, when the system slows down. Testosterone is the main fuel for the male reproductive system. It controls desire, sperm production, prostate function, seminal fluid production. When testosterone drops, fluid production also decreases. You may also notice lower libido, weaker erections, fatigue, low energy, mood changes. A simple blood test can confirm this. And if needed, carefully supervised hormone therapy can often restore function, energy, and confidence. This is not just aging. It is a treatable condition. When should you worry? Most cases are harmless. But seek medical advice urgently if dry ejaculation is sudden and combined with pain, blood in urine or semen, fever, numbness, sudden loss of sexual sensation. These symptoms need immediate evaluation. The emotional side, the part no one talks about. About. Many men quietly connect semen with masculinity and performance. When fluid disappears, confidence can drop. Some men begin avoiding intimacy. Others feel embarrassment, anxiety, or frustration. But understand this clearly. Your value as a man is not measured in milliliters. Your pleasure, connection, and emotional closeness can remain strong. Once you understand what's happening inside your body, fear disappears, and confidence returns. Final message. Dry ejaculation is common. It is usually harmless. And in most cases, it is treatable. Knowledge removes fear. Understanding restores confidence. And communication rebuilds connection. If you found this video helpful, give it a like and share it with someone who may need it.